After talking about the acute rhinitis, in which we mentioned mainly about the viral rhinitis and then influenzal rhinitis, let's talk about the bacterial rhinitis. Now in this section we will talk about different types of bacterial rhinitis and what are the different causative agents for the bacterial rhinitis. Then other thing we will discuss is diphtheritic rhinitis and also irritative rhinitis. Different types of bacterial rhinitis. So as the name shows, this is the rhinitis which will be caused by different bacteria. So bacterial rhinitis, we will have non-specific infections in bacterial rhinitis, and we can have diphtheritic rhinitis. Non-specific infections are further subdivided into primary infection, in which usually the children are mainly affected, and this infection, primary infection, is caused by pneumococcus, streptococcus or staphylococcus, and there is grayish-white tenacious membrane may form in the nose. So in this primary infection, this can lead to the formation of membrane in the nose, and then that membrane in the nose can cause nasal obstruction, and then features of obstruction are also present with this primary infection. So it's more common in children, and it is caused by pneumococcus, streptococcus and staphylococcus, and it can cause grayish white membrane in the nose and then cause obstruction of the nose. So non-specific infections, primary, and also is secondary, and secondary is result of bacterial infection supervening acute viral rhinitis. So as the name shows, secondary is viral infection is already present, and then there is supervening bacterial infection, that is secondary infection. So bacterial infections, we divide that into non-specific type and then diphtheritic type. Non-specific is further divided into primary and secondary. Primary is more common in children, caused by pneumococcus, streptococcus and staphylococcus, can cause membrane in the nose, and then the secondary is usually caused by bacterial infection which is supervening or over the viral infection that was also present or already present. So it's the secondary bacterial infection. Diphtheritic rhinitis, as the name shows, it is caused by diphtheria. So diphtheritic rhinitis is rare, not very common. It is primary or secondary to faucial diphtheria, acute or chronic form. Grayish membrane is seen covering the inferior turbinate and floor of nose. Membrane is tenacious. Excoriation of anterior nares and upper lip. And treatment is isolation of patients, systemic penicillin and diphtheria antitoxin. So all these are the different forms or features of diphtheritic rhinitis caused by diphtheria, and it is rare. Can be primary or secondary, as we talked about the bacterial rhinitis, can be acute or chronic, and in this also there is formation like primary bacterial infection which causes grayish-white membrane in the nose. This leads to formation of membrane in the inferior turbinate and floor of the nose. So this can cause nasal obstruction also because of formation of the membrane. Membrane is tenacious, and there is also excoriation of anterior nares and upper lip. Treatment is with antibiotic. Penicillin is the treatment of choice, and also diphtheria antitoxin. Next is irritative rhinitis. Irritation can be due to different allergens present in the air that can cause irritation and lead to rhinitis, which is like allergens present in the air, like different pollens, dust mite, debris, and animal dander. Different factors, different people are allergic to different allergens. Like a lot of people have seasonal allergies. Some people are allergic to some animals like cats, dogs, and some are allergic to pollens. So all these are different factors that can cause allergic reaction and cause irritative rhinitis. And these can also are presented as watery eyes, runny nose, itchy throat. People should take precautions who have these irritative type of rhinitis or allergies to different allergens. They should cover their mouth to avoid the entrance of allergens, pollens. They should not have contact with the animals they thought they are allergic to, so that can avoid the severity of their symptoms. So irritative rhinitis, causative agents or the allergens that can cause irritative rhinitis. It's form of acute rhinitis caused by exposure to dust, smoke, or irritating gases such as ammonia, formalin, acid fumes, etc. Again, causative agents can be trauma, maybe due to trauma inflicted on the nasal mucosa during intranasal manipulation, like removal of foreign body. If there is trauma, it can cause irritative rhinitis also. Then the reaction, usually there is immediate catarrhal reaction with sneezing, rhinorrhea, and nasal congestion. So after the exposure to these allergens, whether it's due to environment exposure or due to trauma, there is the reaction that can occur is a catarrhal reaction. Patient starts sneezing and there is a runny nose and nasal congestion. Symptoms may pass off rapidly with removal of offending agent, may persist for some days if nasal epithelium is damaged. Recovery depends on the amount of epithelial damage and the infection that supervenes. Usually if the allergens, they persist, if the pollens are in the environment for like few days, it's usually antihistamines and other treatment options makes the symptoms better. The condition is better to some extent, but as long as the allergens are present or the causative agent is present, usually the complete recovery is not possible. So that was all about the bacterial rhinitis. Then we talked about some irritative type of rhinitis also. So thank you for watching sqadia.com.